Hello everyone. In this video, we'll go over the basics of cerebral palsy. Cerebral palsy is sort of a group of disorders, but they all have one thing in common, and that's an injury that occurred in the developing fetal or infant brain. So this brain injury can happen before birth or after birth, but it always happens somewhere right around that newborn time period. This disorder is characterized by issues with movement and posture, and it's not progressive. That's important. There are other disorders that get worse the older the child gets, but with cerebral palsy, it's an injury that happened once, it caused brain damage, and then the damage stays the same. There's no more progression of that symptom. Certainly, depending on how much physical therapy, occupational therapy, other therapies the patient has been practicing, the sort of level of impairment can change, but the underlying damage will not change. So to summarize that all, it's a brain injury that has caused problems with movement and or posture for the patient, and the injury happens really early in life, sometime around that newborn time period. Now, you might hear occasionally people talking about acquired cerebral palsy. This is basically where there's been a traumatic brain injury, and then the patient develops cerebral palsy-like symptoms, but the patient was already a teenager, an adult when that brain injury happened. So that's slightly different. Usually when people say, I have cerebral palsy, they're talking about this infant time frame. This is the most common cause of physical disabilities for children. And along with it, we know that a significant portion of children will also develop seizures or epilepsy. But we also know that every single case is unique because it is caused by brain injury. The extent of the brain injury and the location of the brain injury will affect how this manifests itself for each individual client. So you'll have to just get to know your clients in order to figure out how cerebral palsy manifests for them. As I mentioned, it is a perinatal brain injury. So a lot of the times we don't know exactly what happened to injure the brain. Sometimes it's an infection, lack of oxygen because of some kind of birth complication. As we mentioned last week, hydrocephalus can cause the brain injury. It can be shaken baby syndrome, which is child abuse, where somebody shakes the baby and damages the brain. So there's a wide variety of causes, but it all boils down to some kind of brain injury in that newborn time period. Here are the different types of cerebral palsy. So we have kind of different names for different symptoms, and then as I mentioned, depending on what area of the brain is affected, then that can change the symptoms as well. So spastic cerebral palsy refers to tight, stiff muscles. You can almost see the word spasm in there. So that's exactly what's going on. Certain muscles are always in a state of spasm. So we call it spastic cerebral palsy. Sometimes this word spastic has been used as kind of an insult or shortened even to, oh, they're such a spaz. So that's unfortunate and really doesn't mean anything. But when we're referring to spastic cerebral palsy, it does have a very specific meaning. So don't be offended, if you see that in someone's chart, if you see that in a health history. The spastic cerebral palsy is caused by damage to the cerebral cortex, specifically the motor control movement across the crown of the head. Motor control area across the crown of the head. So depending what part of the brain was affected, was it just one side, was it both sides, was it more the outside of the brain, the inside of the brain? That can mean just legs are affected, just arms are affected, one side of the body is affected. Depending on where the injury happened, that will determine the symptoms we see. Dyskinetic cerebral palsy, there's two different types, but dyskinetic means bad movement, right? Or disordered movement. So it's always going to be something to do with how the patient moves. For athetoid cerebral palsy, the patient will have sort of writhing rhythmic motions, especially of the upper body a lot of times, but it can be any part of the body affected. It can be even tongue and mouth muscles that are affected. So speech and or eating can become a challenge for those patients. Dystonic cerebral palsy is where there's low tone for the muscles. So it can be really hard for a patient to develop the ability to sit up or stand up, even if they don't have those uncontrollable movements. For ataxic cerebral palsy, specifically the cerebellum has been damaged. So there's a lack of balance and coordination. So even if there's no disordered movement, maybe all the muscles are nice and loose like they should be, but the patient might still have issues with fine motor development and things like walking because of balance issues. And then lastly, of course, we can have patients where there are multiple injuries to the brain, so that it can be any kind of mixture of any of these types of cerebral palsy. So again, that's where we get the individual cases. You know, you have to get to know your individual patient in order to know what their symptoms are. In young babies, when we first start monitoring growth and development, these are some of the signs we might see that give us an idea that the patient does in fact have cerebral palsy. So remember that a patient should be able to start to control their head. As a young infant, one of the first things that develops. So if we see poor head control after about 3 months, if the baby has really stiff limbs that don't wiggle and flail around like babies should, if they're always arching their back, or maybe the opposite, maybe they're really floppy all the time, or again, if they kind of miss these other milestones, can't sit, or their fists stay clenched up for a long time, those would all be sort of the earliest signs we see of cerebral palsy. But certainly for some patients with a more mild case, we don't pick up on the fact that they have cerebral palsy until a little later in life as they continue to miss or are delayed in other motor milestones as they develop. There's a lot of questions about intelligence and cerebral palsy. And the short answer is there's a really wide variation. Again, you have to get to know your patient. There's really no way to make any kind of hard and fast rule of who might have cognitive impairment as well as motor impairment. We can only even estimate, in fact, somewhere between 30 and 50% of patients with cerebral palsy will have some level of cognitive impairment, but that could be anywhere from really mild impairment to a profound impairment. The thing that makes this especially challenging is that cerebral palsy can often affect the mouth, the throat, the jaw, so that communication becomes very difficult. You know, maybe someone can't speak and actually their arms are impaired too, so they can't really use a speech board. So if there are communication difficulties, then of course it's very difficult to assess someone's level of understanding of the things going on around them. So we're not exactly sure all the time whether someone has a cognitive impairment or whether they just cannot express themselves, whether they're sort of trapped inside their own body. So the best rule of thumb here is to assume that your patient with cerebral palsy understands everything that's going on. Speak to them like you would to any other patient. Do your best to involve them in their own decision making, and you know, just treat them with that general dignity and respect that you yourself would want to be treated with. There is no cure for cerebral palsy. We have no way of going in and fixing the damage that has been done to the brain. So instead, we're relying on physical therapy, occupational therapy, speech therapy, all of the many therapies. They're very much an interdisciplinary team working here to try to optimize quality of life for the patient that we're working with. Some of the first skills we'll always work on are things like communication, self-care. Of course, the ability to move is useful as well. Appearance can be a real challenge for patients if they have uncontrollable movements or a lot of contractures of their limbs. So we can work on optimizing that. If there are really severe contractures, we'll also have to worry about skin breakdown. For example, if the arms are really pulled tight up against the body, the inside of the elbow has a tendency to develop yeast infections, which leads to a lot of skin breakdown. Just being in a wheelchair 24 hours a day can lead to pressure ulcers, of course. So we're going to try to minimize any of those complications as much as possible. and then optimize things like education, playtime, socialization, so that the child can live as normal a life as possible. Some of the ways we do that to kind of help the patient out, in addition to just having therapists work with them, sometimes the orthopedic surgeon will get on board as well, especially for spastic cerebral palsy. It's really common for kids with cerebral palsy to wear what we call ankle foot braces, or you might hear ankle foot orthotics, AFOs. This is to help keep that foot in a position that makes walking possible. With the really tight muscles, a lot of times you get a very pointed toe. So although it's possible to walk around on your tiptoes all day, you're much more stable if you can walk on your flat foot. So they'll use these orthotics that you see here to force those toes up so that we have that flat, stable walking surface. And then maybe the child will use crutches for balance as well. In really significant contractures, we might even move to surgery to release really tight muscles. If there's been any kind of bone deformity from the ongoing muscle tightness, they can try to correct that. They might even use casting to sort of progressively stretch a muscle or a tendon. And then, of course, PT-OT. This picture here down in the corner, another option that some patients really enjoy is working with a service dog who might be specially trained to open doors for them, pick up things if they fall on the floor, to turn on and off lights, to go fetch things. You know, there's a lot of services that a service dog might be trained to do for someone with any kind of mobility issues. Some dogs, in fact, will be trained to be a brace. So when the patient tries to stand up, they can actually lean all their weight against the dog. Or if they're transferring from wheelchair to bed, of course, that's going to require a big, sturdy dog. But there are so many options. And so for anyone who likes the animals, is looking for a little extra independence, that's certainly something we can connect them with the right organizations and try to make that work for them. As a nurse, here's all the many things we're going to be thinking about. For some patients, nutrition will be a piece of cake and not really a problem. But if the jaw, mouth, tongue, muscles are affected in any way, nutrition can become a real challenge. There might be an increased risk for aspiration. There might just be no ability to swallow. So some patients might end up with G-tubes for feeding. So there would be a lot of family support and teaching there. They might need different kinds of protective equipment, whether it's to protect skin, or maybe they have uncontrollable movement of their jaw and need to protect the tongue and the cheeks from injury, so on and so forth. Just making sure whatever their specific symptoms are, that we can help protect against any further injury. This can be a difficult diagnosis for the family, but just making sure they have everything they need, making sure the family and the patient get rest that they need, whether it's respite care, so the child goes to sort of medical daycare, if you will, so the family can go do other errands and things. Maybe it's scheduling our therapies so that they don't all happen right in a row, so that the child has time to take a break, take a rest between all those different therapies. So just kind of keeping that holistic view in mind can be really important for families affected by cerebral palsy. Just like eating might be a challenge if the mouth muscles are affected, dental care can be a real challenge. A lot of times the jaw muscles will be so tight that a patient can't really open their mouth. So obviously it's going to be a challenge to brush teeth at home, but even going to visit the dentist can require deep sedation in order to get those muscles to relax so they can get in there. So suddenly something as simple as going to the dentist every 6 months can require actually being there for a full day to allow for the time for anesthesia to kick in and then wear off. We mentioned making sure there's options for socialization, play, leisure activities. Any kind of pain we'll of course stay on top of, although fortunately for a lot of patients, the pain is usually more associated with certain procedures that have happened, so it's more of a short-term concern. And then lastly, In a few slides here, we'll talk about controlling specifically spasticity and how we might use different medications, therapies, or like I mentioned, even surgery to try to release some of those tight muscles to prevent any further complications. A lot of patients with cerebral palsy will rely on different kinds of assistive devices to get them up and mobile. So depending on what the needs are, how old the child is, it might be just a really fancy stroller for when they're young. And we might move to scooters, wheelchairs. It could just be crutches, tricycles, so many options. So let's just have a look at a few of the features on these two wheelchairs here. The one on the left is more designed for somebody to be pushed around. You can see in the back, we've got the handles, and there's actually a handbrake. So if you're going down a hill, you can apply the brake so it's not quite so hard to pull them back. On the sides, we have these padded guards so the client doesn't go sideways out of the chair. There's a headrest to keep the head in the right position. And then you can see these cross straps. So I'm guessing this wheelchair is probably for somebody with spastic cerebral palsy who has tight muscles and then poor trunk tone, so they have difficulty sitting up straight. So we can use the straps and then these side guards to keep them in the correct position. This wedge in the middle here is used to prevent what we call scissoring, where the adductor muscles in the thighs are so tight that the legs will actually cross. And again, that can make things like hygiene really difficult, and of course is going to make walking impossible. So they'll sort of build stretching exercises into the entire day's routine, including this wedge in the wheelchair. The wheelchair on the right is more for a client, oops, sorry, I didn't mean to push the button, here we go. This is more for a client who is a little more independent. It is a motorized wheelchair, so you can see just the small little joystick there is going to control the movement of the chair. So we don't need any upper body strength and only just a little bit of coordination to make the chair move. There is a seat belt to keep the client in place, and the legs will actually strap in as well, because this chair is designed, as you can see, to stand up. For someone who sits all day long, we can have a lot of issues with pressure, with even just comfort level. Certainly reaching things become a challenge. So these chairs that will stand the client up help with just general overall well-being, but they can also help with accessibility. Things like reaching light switch, reaching cabinets in the kitchen becomes a lot easier with the assistance of the chair actually standing you up. So that's a nice option for people too. Okay, so there are some medications we can use. As I mentioned earlier, a significant portion of patients with cerebral palsy will also have issues with seizures. So certainly someone with CP might be on an anti-seizure medication. And then these other two medications are used specifically for spastic cerebral palsy, and we're trying to get those really tight muscles to relax. So the first is botulinum toxin. This is Botox, right? Famous for relaxing muscles in the face so you don't get wrinkles. But here they'll be injecting the Botox into some of the tightest muscles in the body. And what it does is it paralyzes those muscles. So Botox is not useful if you are, for example, trying to treat spasticity in the legs of someone who then wants to be able to walk, because now those muscles will be paralyzed. But for someone who has limited mobility anyway, Botox might be a useful way of improving hygiene, improving flexibility, improving the fit of clothing and wheelchairs and things by actually just sort of killing off that muscle, if you will. An antispasmodic called Baclofen is used to relax the muscle tone without the accompanying paralysis. And you can certainly administer Baclofen PO, but there are a lot of systemic side effects that come with it. It's very sedating for a lot of patients. So instead, the preferred way to deliver Baclofen is with this intrathecal pump. So they put a little catheter in the space here surrounding the spine This is kind of like getting an epidural in labor, right? So it's not actually in the spinal column, but just in the space right inside the spine there. And then there's this little pump that gets implanted into the abdomen, and it's a reservoir that's filled up with this baclofen medication. And then it slowly, constantly delivers doses of baclofen into this area of the spine. And depending on where you place the catheter, those are the nerves that will then be affected. So, for example, if someone had a lot of spasticity in their legs, we would put the pump in this lumbar region here because this is where the legs are, where the nerves going to the legs originate. So then just the legs will be affected, and we won't have the same systemic side effects that we would if the patient was taking it by mouth. For most patients, a filled reservoir lasts about 4 to 6 weeks. And then when it starts to get low, they'll have to feel the pump through the skin in their abdomen, take a syringe, go through the port, and inject more medication into the pump. And then they go on for another 4 to 6 weeks. This is more for slightly older children. You do have to be at least 30 pounds just because of the way the dosing works. And the other thing they like to do is a trial of baclofen PO just to see if it actually works to treat symptoms, make sure you're not allergic to it, so that, of course, you don't go through a major surgical procedure just to find out the medication isn't going to do anything for you anymore. You can still have side effects, so we will certainly watch out for those. But for a lot of patients, the Baclofen pump is great. Really works well without a whole lot of systemic problems related to it. So that's our overview of cerebral palsy. We'll now continue. There are a few other videos for you to watch, and then the Picmonic is available for you from your textbook online. And if you have any questions, don't hesitate to send me an email.